Hello everyone, welcome back to neuroanatomy sessions. So today is the last part of the spinal cord, that is about the blood supply and some clinical aspects associated with the spinal cord. So first with the arterial supply of the spinal cord. So basically the spinal cord is supplied by anterior spinal artery. So here we can see the anterior spinal artery. So usually there are two anterior spinal arteries which joins after a short course to form a single large artery called as anterior spinal artery, which runs in anterior median fissure of the spinal cord, and it supplies the anterior two-thirds of the spinal cord. And this anterior spinal artery, we can see it is getting origin from we can see the post vertebral arteries. The right and left vertebral arteries joins to form the basilar artery. So vertebral artery, we know it is a branch of first part of subclavian artery, and vertebral artery, it ascends in the neck from foramen transversarium of C6 cervical vertebra until the C1, and after crossing the C1 atlas it enters into the foramen magnum, and right and left vertebral arteries joins to form a single artery which is called basilar artery, which is located in the basilar groove. So before joining to form basilar artery, we can see the anterior spinal arteries are given off from the vertebral arteries, and the right and left anterior spinal arteries, they are joined to form single large, which is called anterior spinal artery, supplies two-thirds anterior part of the spinal cord. And this anterior spinal artery, it is not enough to supply the whole length of the spinal cord. So there are the reinforcing arteries which are present in each part of our body, which are called as segmental arteries. So there are segmental arteries in the neck called as ascending cervical arteries, segmental arteries in the thorax called as posterior intercostal arteries, and segmental arteries in the lumbar region as lumbar arteries. So these are the segmental arteries which reinforce the arterial chain which is descending from the anterior spinal arteries. So now we know anterior spinal artery is formed by the union of two arteries, two vertebral arteries, by union from, that is anterior spinal arteries arising from the two vertebral arteries, and it supplies anterior two-thirds of the spinal cord. Next, about the posterior spinal arteries, they are two in number, and we can see the posterior arterial chain are two separate chains. Unlike the anterior is single here, posterior are double, and they are two in number, which further divides near the posterior spinal roots, and these arteries arise from the vertebral arteries. Sometimes they arise from the posterior inferior cerebellar artery, which is a branch of vertebral artery, or sometimes they may arise directly from the vertebral artery. So either they are from the pica or they are from the vertebral arteries, and they descend close to the posterior roots of the spinal cord and supplies posterior one-third of the spinal cord. So that is about the posterior spinal. And posterior spinal arterial chains, we can see it is reinforced by the segmental arteries, the same segmental ascending cervical, intercostal and lumbar arteries. So ascending cervical in the neck region, posterior intercostal arteries in the thoracic region, lumbar and also lateral cervical. And all these arteries reach the subarachnoid space and they ramify into anterior and posterior radicular arteries. And one clinical aspect which I want to mention here, at the level of T1, that is at thoracic 1 segment, at the level of T1 and at the level of T11, at the level of T11, at the level of T11 and T1, the artery of Adamquist or Arteria radicularis magna, which are the largest segmental arteries supplying the most of the spinal cord. So blockage of these arteries causes the major necrosis of the spinal cord tissue. That was about the arterial supply. Next, the venous drainage. The spinal cord drains into 6 longitudinal venous channels. So here you can see the anterior median vein, which is along with the anterior spinal artery. Here is the posterior median vein, and we can see the two anterolateral veins on each side and two posterolateral veins on each side. So it drains into 6 venous channels, and these veins drain into intervertebral veins. So we can see here. So this is the dura mater. Outer to the dura mater in the epidural space, the venous plexus. This is the epidural space. They are called as vertebral venous plexus, which are also called as Batson's plexus. So these spinal veins, they drain into vertebral venous plexus. So the veins drain into internal vertebral venous plexus or Batson's plexus, which further drain into radicular veins, and radicular veins drain into segmental veins that are the vertebral veins and posterior intercostal veins, lumbar veins, sacral veins. All these communicate with the intervertebral venous plexus. So I repeat, the veins drain into radicular, radicular drain into segmental, segmental drains into posterior intercostal in thoracic region, lumbar in lumbar veins, and sacral veins. So any cancer cells, suppose in the mammary gland, via the posterior intercostal veins, they reach the vertebral venous plexus and spread into the spinal cord. So that is about the venous drainage of spinal cord. So that was about the blood supply, and next we shall continue with the clinical aspects. Hemisection of the spinal cord, which is called as Brown-Sequard syndrome. Brown-Sequard syndrome is ipsilateral motor paralysis, that is same side motor paralysis, ipsilateral motor loss, and ipsilateral loss of proprioceptive senses as well, and contralateral loss of pain and temperature sensation. So hemisection, half of the spinal cord is cut, most common during stab injuries. So because of stab injuries, hemisection occurs, which results in ipsilateral loss of uh, touch sensation, proprioceptive sensation, and motor loss as well, and contralateral loss of pain and temperature sensation. So that's about the all about the spinal cord. So we completed the spinal cord as external features, internal features, blood supply, and clinical aspects. Thank you.